how are you? It's Juan with Hands-On Therapy Services. How's everyone doing today? I'm doing good. It is hump day, right? It's middle of the week. It's Wednesday, and kind of was like stumped on what we were going to talk about today. But I did just work with an elbow patient of mine. She had a pretty severe arm injury, so we've been working with her on her elbow, her wrist, her hand. And sometimes when your whole arm, when you have such a severe injury like that, it's going to affect your shoulder at some point as well. So every once in a while we'll check and make sure that her shoulder's not getting too tight and she's not developing any issues with her shoulder. So yesterday she was starting to have a little bit more pain. It's getting a little tight, but we been keeping in check. But we want to make sure that we focus on that elbow, making sure that elbow moves really well. So the best comment of the day was, she tells me, she's like, I don't know, because one of the things that I like to do is, not everyone can come all the time. People have busy schedules, but one of the things is when you're really desperate and your arm's really, really bad, you're gonna come all the time. You're gonna come as often as you want. You're gonna be really good. But one of the things that happens is, as you get better, okay, and I said this to her before, as you get better, you're gonna start to do this thing where you start making excuses and saying, oh, something came up and I couldn't make it there this time, can I come? So things get kind of scheduled around, and therapy doesn't land at the top priority anymore, which kind of sucks. But our goal is really to try to get everyone better as fast as possible to their 100%, because that's what everybody wants. So one of the things that I like to do is teach everyone different ways that they could stretch themselves, at least, so that they can make the progress faster. And for her, since it was so involved, I was trying to make sure that we taught her her cousin to help, and her family, like different family members to help. And it's hard because they're not necessarily health professionals, and we try, but they're not doing what needs to be done, because that's not what they do. They're not certified hand therapists. So it was really funny, because she was like, man, she goes, I don't know, when other people stretch my arm, like they don't have like as much control as you have. She's like, it's like, you make my arm your bitch. And I was like, that's right. Your arm is my bitch, and I'm gonna get this sucker straight. So that was by far my best comment of today, of this week, and it's always my pleasure to help everyone get better. But it was really funny. So yeah. So sometimes it's it's tough getting 100%. So let's see. Alright, so if you have any questions, just make sure to leave a comment below. If you've had an elbow injury, tell me a little bit about it. What's the struggle? Elbows are really tough because you have to be able to bend. It's funny because we never really think that elbows are, I don't know, they're pretty important, but sometimes we sort of forget. But if you cannot bend your elbow, you cannot eat. So once I had this guy, he broke both his elbows. That's pretty bad. He couldn't do anything. But yeah, elbows can be pretty bad because you can't turn your palm up to wash your face, right? Sometimes it affects your hands and wrists. You can't move that. But yeah, you can't bend your elbow. You can't eat. You can't pick your nose. Can't scratch your ear. My sister's laughing at me, but it's true. It's true. Can't put your hair up. Can't put your earrings on. But believe it or not, bending your elbow is easier to get than getting your elbow completely straight. So that's something that I always, you know, stress a lot with my elbow patients. But if you have any questions regarding your elbow and the struggles you are going through, then leave me a comment. I'd love to hear from you. I'd love to hear what struggles you're going through, and I'd love to be able to help you anywhere I can. All right, Swang with Hands-On Therapy Services. I think I forgot to say that at the beginning, but I will talk to you tomorrow.